tell you the truth about plantar fasciitis. First of all, thank you for commenting. You want me to talk more about foot pain. You are recovering from second round of plantar fasciitis and discovered bunions. I actually love the foot and ankle. Call me a fucking foot fetish freak in terms of physical therapy because I eat that up. I love talking about the foot and ankle because the foot is literally our foundation. If our foundation is fucked up, of course, you're going to have knee pain, hip pain, back pain, whatever. Like, the foot is so important and so underrated. But besides the point, going back to plantar fasciitis. Plantar fasciitis is literally just inflammation of the plantar fascia. The plantar fascia is not a muscle. It is connective tissue that gets inflamed pretty much because your foot and ankle is weak. At the end of the day, it's going to be weakness and lack of mobility. So doing any type of deep foot muscle strengthening work like toe yoga, doming, arch lifts, heel raises, working your big toe. The big toe is super important in terms of supporting that arch and strength in the middle of the foot. I'm going to guess that you probably have weak calves too. Fascia, I think that a lot of people are just misinformed on it because a lot of times medical doctors will try to give like braces, splints, or whatever and just say like rest, which actually is what we don't want to do. I mean, you can definitely use the splints for like recovery after like a long day of walking or being on your feet, but we really just want to strengthen and mobilize the foot and ankle at the end of the day. So I can definitely give you some more exercises and tips for that. Let me know if you have any other questions. As a physical therapist, I see this all the time, like Achilles tendinopathy, posterior tibialis tendinopathy, plantar fasciitis. All of it comes back to weakness at the end of the day and tightness. So mobility work in the foot and strengthening. Also, toe spacers. Did you say anything about toe spacers? Toe spacers would be great for bunions, especially because that's like your joints, so it's gonna give some more space in the joints. So toe spacers could be great for that, for the bunions specifically, and actually it might help the plantar fascia as it'll stretch out those deeper foot intrinsic muscles, so you can look into that as well.